All right, so women's health agents. So this is in chapter 34, page 524. Um, Select women's health agents. So when we're talking about preterm labor, the definition is a pattern of uterine contractions which will cause fetal delivery prior to 37 weeks gestation, right? So that's preterm labor is prior to 37 weeks. Selected agents, we give different source of medications. I'm only going to go over a couple of them because you're actually going to have an OB rotation later on in your semesters. But the prototype generic you'll need to remember is terbutaline. Terbutaline is an adrenergic and bronchodilator, but it causes relaxation of smooth muscles, right? So our mommy who is going into labor, if we give this medication, it relaxes smooth muscle. Well, the uterus is one big muscle, right? So it's going to relax that uterus, and therapeutically speaking, it's going to inhibit uterine contractions. Important to remember, okay? That is the unlabeled use of terbutaline as we give it for uterine contractions. So indications would be preterm labor. Nursing action, so we really want to be caution with cardiac disease and hypertension. It is an adrenergic, remember, so it can cause stimulation. Available in PO and parenteral, so it can be given sub-Q, PO, or IV. So typically for our mommies, we give it sub-Q. And then just be aware it can cause tachycardia and palpitations. Magnesium sulfate, so therapeutic effects, it also causes smooth muscle relaxation. So it'll also inhibit uterine contractions, and indication would also be for preterm labor. So as a nursing action, we want to make sure the goal is to magnesium levels, goal magnesium levels much higher than standard reference. So meaning we are magnesium levels for a patient we're giving magnesium sulfate to, the standard or their level is going to be higher than what a normal person's magnesium level will be because of the indication as to why we're using it. So because of that, we have to make sure that we're very on top of our neuro checks, and we're looking at their reflexes, such as DTRs. DTRs are deep tendon reflexes. If a patient has magnesium toxicity, so they have too much magnesium, they could have hyperreflexia clonus, and that is basically gives the patient also increased risk of convulsions. So they might have seizure if their magnesium levels are too high. Postpartum uterine dysfunction. So this would be for the failure of the uterus to contract sufficiently to stop bleeding, right? So we have maybe a boggy uterus that's not contracting back to the way it should be. And because of that, the patient could hemorrhage. So there are some selected medications that we give for this. I'm just going to tell you right now, you can review these, but the one I want you to focus your attention on is oxytocin. Okay, that's typically what we actually give in L&D, more so than the other medications listed here. So with oxytocin, the therapeutic effect is we stimulate that uterine muscle. It also enhances lactation. So indications would be induction of labor. So if we want a mommy to go into labor, we could give this. And then if our patient has, important to remember, increased postpartum uterine bleeding, we can give that too to help that muscle contract and clamp down and slow down or stop the bleeding. And then again, it aids in lactation. So nursing actions, monitor of strength of uterine contractions with induction. And then there's also a nasal spray available, although I've actually never seen that, but there is. All right, so miscellaneous. We have a bunch of miscellaneous medications here. Most of this section I'm not going to be really testing you on either. However, so you can look at like bisphosphonates. This is in Women's Health on chapter 34, page 533. You can look through these. You might have heard of, I don't know if you've heard of Aldernate, or otherwise known as Fosamax. That is a prototype. That is a medication we do not crush, chew, or suck on. It just needs to be swallowed. But we would give this for patients that are at risk or who have decreased bone loss in order to decrease hip fractures, spinal fractures, and those types of things. So that's biphosphonates. And here's your Aldernate, what I was mentioning earlier. So that's the prototype for this. In regard to men's health, there's also a bunch of medications listed for men's health, but what I really want to bring your attention to, what I really want you to know and understand for testing purposes is letter B here. which is phosphodiesterase inhibitors. What this does is it promotes smooth muscle relaxation and inflow of blood. So why is this important? So we think about especially our older patients, maybe that have issues with erectile dysfunction. They would be on this type of class of medication. So therapeutically speaking, it does aid in penile erection. We also may give it for patients who have pulmonary hypertension. It just kind of slows that progression, can also help reverse some of the damage that has occurred to the heart and lungs. Precautions and contraindications. All right, big area you need to remember for this class of drug, okay? So absolute contraindications is if the patient has any type of concurrent use of nitrates in any form. So remember, nitrates causes what? I want you to review that. What does nitrates cause? You're going to see that in cardiac. Any use of nitrates in any form would be contraindication for a patient to utilize this class because of the profound hypotension and possibility of death. So if you don't remember what nitrates do, I need you to go back to cardiac and review that. Important, okay? So also contraindicated or precautious with heart disease, MI, cerebrovascular accident, CV, or stroke. Again, review cardiac so you remember or can correlate as to why. Side effects would be hypotension. So sildenafil is the prototype you will need to remember for this particular class that is otherwise known as, or trade name, Viagra. And that is what I really want you to concentrate for the men's health section, okay? So again, review all these, definitely important, need to know information, but in regard to testing, that's what I really want you to focus your energy, okay? So